In my experience, the recognition that disorders of the spinal cord can be associated with chronic pain has often been undervalued or underestimated. I think that over years it's become clear that a variety of different disorders that can cause spinal cord dysfunction are present in people who have ongoing pain. We typically think of spinal cord compression, the most common reason for such being cervical spondylosis or spondylitic, arthritic, degenerative changes that may occur over time. They may ultimately result in bony encroachment of the spinal cord, either in the thoracic or cervical, more likely cervical region. We often overlook the non-structural reasons, such as various vitamin deficiencies, metabolic disorders in general, and also various infections. And so these need to be looked at as well. And there's actually quite a long list of potential etiologies to myelopathies, which is a term used to describe in general disorders of the spinal cord, that result in ongoing pain. And the clinician should be aware of the both structural and non-structural etiologies when evaluating that. What is important is recognizing from the history and also the physical examination, which is old-fashioned, but still, the presence of a spinal cord abnormality. I just spoke to a person today who had been referred to me with post-laminectomy, lumbar laminectomy pain, persistent pain in her lower extremities, 3 spinal surgeries, and upon initially examining her in July when I first met her, or August when I first met her, it was obvious that she had reflexes and muscle tone and a physical sensory examination that was consistent with a spinal cord abnormality. And so unevaluated until that point was the possibility of a myelopathic cause of her symptoms. And to make a very long story short, she had a cord compressive lesion due to cervical spondylosis in her neck. And there's no way that one would expect lumbar spine surgery to help someone who has this other condition as well. And it may have changed the approach to treating her if the cervical spine abnormality had been recognized first. I think it's important to recognize the complaints and the physical examination findings for a person that a person may have that suggests a spinal cord abnormality or a myelopathy, and pursue either by referring to someone who can further assess, but pursue the raising the question in one's mind before someone undergoes rather invasive treatment can actually help in the long run. So it's not to say that a person may not have more than one condition associated with their complaints. It's that knowing the whole story always helps.